In this lecture, we will discuss the QT interval, specifically what it represents, how to calculate it, and how it should normally appear on the EKG. The QT interval represents the time from the onset of the QRS complex to the end of the T wave. If you look here, here's our P wave, this is our QRS complex, and this is our T wave. And we're saying from the onset of our QRS, so this point here, until the end of our T wave, this is our QT interval. Notice that it includes the QRS complex, the ST segment, and the T wave. All right, we said our QRS complex, ST segments from here, the ST junction or J point at there until the beginning of our T wave. So that's our ST segment and our T wave. So QRS interval equals QRS complex, ST segment, plus the T wave. The QT interval represents all of the events of ventricular systole, from the beginning of ventricular depolarization to the end of ventricular repolarization. Okay, so if you notice here, we have ventricular systole, right? This portion here is ventricular systole, then we have ventricular diastole, where we have relaxation of the heart, and notice that the QT interval is part of all of this. Okay, the ventricular systole is within our QT interval. That means the QRS complex, which represents ventricular depolarization, and our T wave, which represents ventricular repolarization. Okay, now the QT interval can vary for many reasons, including age, sex, heart rate, and electrolyte abnormalities. In general, it should be less than 1/2 of the preceding R to R interval. The R to R interval is simply the interval between the two peaks of two consecutive R waves. Okay, so let's just erase some of this here so we can see what we're talking about. Okay, now we're talking about the R to R interval. Okay, and here's our R wave of one complex, and the next one would be here. So we call this portion here our R to R interval. Okay, and we're saying that in general, the QT interval, so from here to here, should be less than 1/2 of the R to R interval. Okay, so if we took half of it, maybe about at this point, we're saying that the QT interval from here to about here, all right, if you put that there, it should be less than 1/2 of that R to R interval. Okay, and that's just a general rule of thumb and something that you can use. Now, the best leads to measure the QT interval appear to be in lead 2, V5, and V6. And you want to use the greatest QT interval in one of those leads. Okay, so get the maximum interval, that's the one you want to use. There's one thing I want you to be aware of because it's commonly a cause of confusion, and it has to do with where the T wave ends. Sometimes you can see a hump at the end of the T wave, and this can be a U wave, okay? And what we call this is TU fusion. And you'll notice here, there's no U wave here at all, okay? But if you look down here, this end portion of our T wave, here's our T wave, is a U wave, okay? And again, you see it there. All right, and you can see that it's taking a part of our T wave. It's almost combining, and because of that, we call this TU fusion, okay? The two waves coming together and fusing. And in such cases, we want to use the maximum slope intercept method to define the end of the T wave. And we will include the U wave if it is greater than 1 millimeter in amplitude. If it's not, then we won't include the U wave, okay? So let's go over this maximum slope intercept method. What we do here is we look at our U wave, okay, it's part of here, and we look at the amplitude of it, all right? So amplitude meaning from the top of the peak to the bottom, all right? And again, from this point to the bottom. And we're saying that if it's greater than 1 millimeter, if that U wave is, then we'll include it. If not, then it won't be included. And so in this first case, we can see that it's short, so we're not going to include this terminal portion. And because of that, we will take our maximum slope from the top of the T wave and extend it down, okay? And where that intercept happens, we take it down as our end of our T wave, and so we make our QT interval from the beginning of our QRS to that point there, okay? Now in the other case where we have a U wave that's greater than 1 millimeter, we want to include it, all right? So in that case, we go to our U wave, which is there, and take a slope all the way down, all right? Again, where that intercept meets the baseline, so this green portion here is our baseline, okay? And we're extending it here. So notice there's that point here we're meeting, okay? So this point here is where they're meeting. You extend that down to as the end of the T wave, and then we take the beginning of our QRS, and then this whole portion defines our QT interval, okay? So that's called the maximum slope intercept method. Okay, now generally speaking, females have a longer QT interval than males, and one of the main variables affecting the QT interval is the heart rate. As the heart rate increases, the QT interval shortens, and as the heart rate decreases, the QT interval tends to lengthen. In other words, the heart rate and the QT interval are inversely related to each other. Due to this variation of the QT interval with heart rate, the QTC interval, which stands for QT corrected interval, attempts to adjust for it. The QTC interval improves the detection of patients that are at greater risk of developing arrhythmias. The most common formula used to calculate the QTC interval is called the Bazet formula. Okay, and you see that here. The Bazet formula is the QTC interval, and then you put the QT interval over the R to R intervals in seconds. Okay, and one thing to be aware of, if our R to R interval, if our rate, say our heart rate is 60 beats per minute, okay, that means our R to R interval is equal to 1 second. So simply our QTC interval in that case would be the QT over 1, or simply whatever the QT interval was, okay, at 60 beats per minute. All right, now there's many other formulas that have been devised, but this is a great start. You may have come across like the Federici formula, where they take the same thing and it's the cubed root of the R to R interval. But again, the Bazet formula is the most common one. All right. And oftentimes the QTC interval will actually be calculated for you by the EKG machine, so you're not really doing much there. So what are the normal values of the QTC interval? Well, this varies based on the source that you reference. In general, for normal in males, right, males and females are different. And we said males tend to be shorter. In males, it's 440 milliseconds, that upper threshold. And for females, it should be less than 460 milliseconds, okay? It's also important to be aware of the QT interval being too short. Okay, we call some of these short QT syndrome, and these patients would be at risk for also developing arrhythmias. All right, so again, the QT interval should be greater than 350 milliseconds. Now, one value to keep in mind is 500 milliseconds. Okay, if the QTC, the corrected QT interval, is greater than 500 milliseconds, it puts the patient at an even greater risk of developing arrhythmia, specifically one called torsades de pointes, okay, or simply torsades. All right, and this is a polymorphic VTAC and a life-threatening ventricular arrhythmia. All right, let's briefly review what we discussed before we end. The QT interval represents the time from the QRS onset, right, to the end of our T wave, right? We mentioned that. The QT interval includes the QRS complex, the ST segment, as well as the T wave, and it includes all the events of ventricular systole, right? Depolarization and repolarization. The QT interval duration is variable. We said based on age, sex, heart rate, electrolytes, and so forth. In general, the QT interval should be less than 1/2 the preceding R to R interval. Remember, it's best measured in leads 2, V5, or V6, and we want to use that maximum QT interval as the one we use for defining it. If we said if there's TU fusion, we want to use that maximum slope intercept method to define the end of the T wave to then get the QT interval. Remember, we include that U wave if it's greater than 1 millimeter in amplitude. Females tend to have a greater QT interval than males, okay, and that's why that cutoff was higher in females. And remember, the QT interval tends to be inversely related to the heart rate. As the QT interval shortens, the heart rate will go up, okay, or the other way. If the heart rate is faster, the QT interval will be shorter, okay, so it reflects the heart rate. If the heart rate is slower, the QT interval will be greater, okay, and you can, go back to the R to R interval and relate that to the heart rate if you want. Now, the QTC interval, we said this is the corrected form, that C for corrected, and it adjusts for heart rate, all right? And this improves the detection of those patients that are at increased risk for developing arrhythmias. We talked about the Bazet formula, which is the most commonly one used, okay? There's also the Federici and many others that have been devised. The normal QTC interval varies with many different sources that you'll look at. In general, use a 460 threshold for maybe both males and females. If you want to use the males 440 milliseconds, you can, and females 460. And remember, it should be above 350, so this is your lower limit there. And remember, 500 as that number, that these patients, if the QTC interval goes above 500 milliseconds, they are at risk of developing torsades de pointes, which is a life-threatening ventricular arrhythmia. Well, that's the end of this lecture. We discussed the QT interval, specifically what it represents, how to calculate it, and how it should normally appear on the EKG. I hope you learned something.